Namaskar. Myself, Dr. Lakshman Suthar. I am clinical cardiologist working in Almora. I'm director of Life Care Hospital and Cardiac Care Center, Almora. Today, we are going to discuss about hypertension. Hypertension is nowadays a very rising and serious issue, which generally people are taking not seriously. Hypertension in general in Hindi also known as raktachap, blood pressure, high blood pressure. It is one of the largest non-communicable disease from which people are suffering. What we say is when the blood pressure is on high side, that is, if the blood pressure is more than 140/90, then a person needs medical attention and he needs doctor's advice how to take care of that. So, if we see that nowadays cardiac diseases are very increasing, and in the era of COVID, people are mostly suffering from and dying from heart attack. And one of the most important risk factor of cardiac disease is hypertension, because most of the patients are suffering from hypertension knowingly and unknowingly. The unfortunate thing about hypertension is most of the people are suffering from hypertension, but they don't know that they are suffering from hypertension. So, what are the current guidelines, or what are the things which one should take care so that he doesn't have to face consequences because of hypertension? See, if a person, what current guideline says that if a person has achieved his 20 years of age, then he or she should get his blood pressure checked. And if it is more than 140/90, then he has to take remedies and consult doctor so that it can be controlled. So if you are 20 years old, then you should get your blood pressure checked. And if it is normal, then every year he should get his blood pressure checked. So what are the things that causes high blood pressure? The most important thing in nowadays is inactivity, because most of are working on digitally. So physical activity has decreased in life. So low physical activity in life is one of the major factor. Second is very high salt intake. Now, salt we should take from 2 to 5 gram a day, but we are taking more salt. Salt is also rich in junk foods and on street foods which we are taking. So we should always try to decrease low salt. Alcohol, tobacco, these are also things which can increase blood pressure. And the most important thing in nowadays life is, which everybody sees, is stressful life. Stress can be because of job, stress can be because of family issues, but we have to handle it by counseling and by decreasing the stress anyhow if we can do it. So stress is nowadays one of the most important cause for hypertension. Other things which are, these things which I had discussed are modifiable. That means we can change in these things so that we can decrease blood pressure and make it controlled. And few are non-modifiable things, like for example, if you are male, you have higher chances of having cardiac disease as well as hypertension. If you are 40 plus, then again with age there are chances that your blood vessels get stiff and your blood pressure will increase. And genetic issues also, if your parents or grandparents are having hypertension and any disease which can be passed on by genetics, then it is also a risk factor. So most importantly, risk factors are divided into two parts: modifiable and non-modifiable. The earlier were modifiable, that we can change, and later was non-modifiable. Non-modifiable, we can't do anything about those things. But yes, if we are male and if we are 40 plus, and if we have family history in parents, brothers, then it gives us a chance, that it gives us an information that we should take care of ourselves more seriously and we should be more proactive regarding our health. So these things should be taken care. So blood pressure, it's a serious thing. Why it is caused? Modifiable cause, non-modifiable cause. So what we can do to decrease it? The most, and these things are very simple, because yes, if your blood pressure is on higher side, then whether we control, whether we treat it by medicine or not, but these things has to be done, which I am going to suggest. The most important thing is lifestyle modification, which control, which have in which we include, most importantly, is food habits. The food habits, what is important is we should avoid junk foods. Whatever things are available as pizza, burger, charts, and all those things, they contains high content of uh, salt, and that has to be decreased. If we can stop junk foods, if we can decrease the salt quantity in food, then for example, how can we decrease salt? What usually I recommend to my patient is, you should not keep table salt in the room, because if table salt is available, whenever we feel that there is a low salt in sabji or in anything, we try to put add on it. So that add on raw salt should not be taken. So we should avoid table salt. So low salt diet should be there. Further, we should avoid junk foods, cold drinks, and all those things in packed bottles. We should avoid those things because they conserve preservatives. They contain preservatives as well as raw sugar, which is not good for health. Further, we should also avoid saturated fat. For example, anything which freezes at the room temperature is an example of saturated fat. For example, ghee, dalda ghee, coconut oil, all those butter, and all these things are saturated fat. So we should avoid saturated fat. Further, we should avoid red meat. For example, meat of goat, pig, and cow, and all those meats are red meat. So we should avoid red meat. Red meat also increases the chances of cardiac disease as well as hypertension. So red meat should be avoided. And our food should be rich in fibers. For example, salad should be a part of our food. Raw, anything which is raw, what we say is dash diet or Mediterranean diet. These things are very good for a normal person also, and a person who is suffering from diabetes, hypertension, and cardiac diseases. Dash diet and Mediterranean diet is very good. It decreases the risk of cardiac disease as well as hypertension. So dash diet and Mediterranean diet, which includes seafood and low salt diet and raw food. So these things are very good. So in food, specifically, we should concentrate on these things. And we should avoid tobacco. Tobacco in any form, bidi, cigarette, tambaku, surti, gutka, pan, anything, tobacco in any form, it increases the risk of cardiac disease 5 to 6 times, as well as it increases the risk of hypertension in future also. So tobacco in any form has to be stopped or condemned. Alcohol, if you can stop it, very good, because once it is started, it's very difficult to regulate it and take it in a moderate amount. Anyhow, we lose the control over the quantity we take. So if we can avoid alcohol, yes, it is one of the best strategy. But if we can't avoid it, then the dose should be decreased to 60 ml or 40% of whiskey, or moderate amount it has to be taken. So alcohol, if it can be stopped, it is very good. But if you can't avoid it, then the dose has to be in moderate quantity. So the dose of alcohol has to be decreased. And the most important thing, which I think, is physical activity. It is very beneficial for whatever disease you say, lifestyle diseases which we are facing nowadays, diabetes, hypertension. It is very, physical activity is very helpful. Even nowadays, even after major cardiac surgeries also, we are advocating that patient should be mobilized as soon as possible. Even after bypass surgeries and all those major open heart surgeries, we try to mobilize the patient on day one only. So physical activity is very important. It helps in decreasing the blood pressure, it helps in decreasing diabetes, blood sugar levels. It helps in decreasing deranged lipids in your cholesterol in your blood. It helps decrease in stress in your body. So physical activity is one of the most important thing, which I think everybody should consider. uh, at least, and what is the quantum of physical activity? Physical activity should be done at least 30 minutes a day, a minimum 5 days a week. But I think minimum five, instead of minimum 5 days a week, everyone should concentrate on doing at least 30 minutes moderate, mild to moderate, at least moderate physical activity uh, every day. Now, if anybody is has difficulty in doing physical activity and what kind of physical activity has to be done, then I think the minimum what anybody can do is brisk walking. You should try to walk as quick as possible so that you had sweat on your forehead, and this is a sign that you are doing sufficient physical activity for cardiac protection and as well as to decrease hypertension and diabetes and deranged cholesterol. So physical activity, controlling food habits, and low salt diet, these are the important things which everybody should consider, so that these are miraculous things which helps to control hypertension, diabetes, control cardiac illness, or improve your symptoms in cardiac ailments, um, so that without medicine you can control 10 to 15 mmHg of your blood pressure, and 10 to 15% of blood sugar are decreased by doing only these things. Further, what you can do is, if you are suffering from hypertension, then definitely if your blood pressure is more than 140/90, these things has to be done. Additionally, you should consult your doctor. You shouldn't nobody should ever try to self medicate themselves, because if you don't know the effects of medicine, what they are going to do in your body and what medicine is suitable for you, because there are different categories of antihypertensive drugs. So nobody should try to self medicate, because many patients come to me also, and they what they do is, initially they try to self medicate themselves without knowing whether that medicine is going to helpful to them, or whether it is going to harm them in comparison to benefits. So never try to self medicate yourself. Whenever you feel any symptoms, for example, what are the symptoms of hypertension? For example, if a general person is suffering from hypertension, you see many patients don't have symptoms. That's why these diseases, hypertension and diabetes, unfortunately, many patients, 30% of patients don't feel any symptoms. That's why these diseases are known as silent killers and silent diseases, because even patients with blood pressure of 200 systolic, they don't have any symptoms. But it doesn't mean that you don't have hypertension or it is not going to harm you. So that's why it is very important that once you achieve the age of 20 years, you should get your blood pressure checked. And every year, then after on, every year, if your blood pressure is normal, then every year you should get your blood pressure checked. And if your blood pressure is on higher side, more than 140/90, then you should be on regular follow-up or regular touch with your medical professional. He will guide you how to handle it. The lifestyle changes, which are important, which I have described earlier, has to be taken care whether your blood pressure is on higher side or not. It is the healthy lifestyle which everybody should follow, so that if you don't have those diseases, then it will not happen if you will follow those lifestyle habits. And if you are suffering from these lifestyle diseases, for example hypertension, then you should follow more rigorously, more seriously, and you should consult your doctor, so that if your blood pressure is on higher side than 140/90, then it has to be brought below it, and the proper medication which has to be taken will be advised to you according to your blood investigation which are necessary to do. For example, lipid, creatinine profile. So these things tells us and guides us which medicine is better for you. And along with this lifestyle modification, we prescribe some medicines which are helpful. And by medication and lifestyle modification and healthy lifestyle, we can bring this silent killer, silent disease under control, so that the micro and macrovascular diseases or complication which can occur because of these diseases in future, you don't have to face those things. So yeah, my I think this information will help you. And always stay healthy and be healthy. Thank you.